Good morning. Good morning. Thank you all for tuning in. Thank you all for tuning in. Today, we are, as I said before, we're going to talk about a couple things. I don't plan to be very long today. Honestly, I think some of my lives have been way longer than they needed to be. So I don't plan to be very long today. I just want to discuss three things or four things, and we go from there. Okay, again, if you have any questions, you can write the questions in the chat in the live, and I would try to answer them as I go along. If I don't know the answer, then I'll let you know I don't know the answer, and we go from there. Okay, so let me start by identifying the fact or reiterating something that is spoken about all the time. We always hear them talk about the kind of spread that we're having in Trinidad and Tobago. The Minister for Health, the CMO, the Prime Minister, they all talk about the fact that we have imported cases, we have what are known as local cases, but I also want to touch on the community cases, community spread. All right, so just quickly so that we're all on the same page, we all know what when we use these terms, what we mean. An imported case of COVID-19 means that someone was outside of Trinidad and Tobago, either in the United States, in China, in Barbados, wherever they were. They contracted the virus outside of Trinidad and Tobago, and they flew into Trinidad and Tobago or came on a boat or however they got here to Trinidad and Tobago. And we now identify them here as having COVID-19, but they did not contract COVID-19 in Trinidad and Tobago. Those cases are considered imported cases, which is why the Minister for Health continually speaks about the fact that 40-something of the positive cases that we have came from the cruise ship, meaning they were on the cruise outside of Trinidad and Tobago and then came into Trinidad and Tobago after the fact. Okay? So that's critical, that's important to be able to differentiate that. We also now have what is known as local cases. Local cases meaning someone got it from somebody else in Trinidad and Tobago. Local cases usually start with an imported case. So let's just say a husband flew in from Miami. So the husband has it, and we've discovered that the husband has COVID-19. And because the husband interacted with his wife in Trinidad and Tobago, the wife now has it. Okay, so that is an example of a local case or a local spread because the wife has it and the wife contracted it in Trinidad and Tobago. You may have primary, secondary, or even tertiary local spread, depending on how far you are. So let's just say you have the husband who flew in, the wife contracted it from the husband, and then the wife went out not realizing what happened, didn't realize that the husband had it, went out, the wife feels okay, goes out to the grocery and talks to a very good friend, they lime in the grocery, and that friend now got it from the wife. That's an example of a secondary contact. And that is also an example of local spread because the person in the grocery got it from the wife. The wife got it from the husband who flew in. So the husband flying in, imported, the wife contracting it from the husband, local. The friend who got it from the wife, that is still considered local. Critical. The thing about imported and local cases has to do with the fact that we know where each case got it from. So the husband, we know that they were out there in Miami. Miami has a lot of cases, so the husband brought it in. We know the wife got it, that husband, we know who she got it from. The friend of the wife, we know who she got it from. She got it from the wife. So we have local spread in that situation. Community spread happens though when you have somebody who out of the blue who did not just travel and does not specifically know anybody who has it. That person now has it. And that is what you consider community spread. So this person is some random John Brown who started feeling sick, started getting flu-like symptoms, has not traveled from anywhere, nobody in the family traveled anywhere. There is no real connection between John Brown and anybody else who we know who has it, but somehow John Brown has it. That is what is known as community spread, meaning people in the community are beginning to pick it up, and we do not know, we cannot trace where they got it from. We cannot trace where they got it from. So I wanted us to start with those definitions, because those definitions are extremely important, and those definitions are what we need to look at depending on who has it, and those definitions are what are going to decide how we do the testing for COVID-19. Okay, those definitions are going to decide how we do the testing for COVID-19, meaning what are the criteria we are going to use to determine whether someone should be tested and someone shouldn't be tested. Okay, now let me look very quickly at the CARPHA, because remember, in Trinidad and Tobago, CARPHA, the Caribbean Public Health Agency, CARPHA, is the only agency right now that is doing testing in Trinidad and Tobago. And they're doing it on behalf of Trinidad and Tobago, but they're also doing it on behalf of other countries. So other countries are sending their samples to Trinidad and Tobago. The Minister of Health in Trinidad and Tobago spoke about the fact that we are going to expand the testing sites in Trinidad and possibly Tobago, but I will come to that a little bit later. What I want to do is explain to you specifically the criteria that CARPHA has been using for testing in Trinidad and Tobago. Now, because COVID-19 is such a fluid thing, because it is new, we are learning so much, and every day you have to keep up with the times, because every day something new is coming up as it relates to COVID-19. And when something new comes up, they change the protocols, they change the rules, they change the advice that they are giving. So according to the CARPHA instructions, and I'm looking to the side because I want to read it specifically from their documents, CARPHA basically said that CARPHA is following WHO guidelines on who is a case and who is a suspected case and who is a confirmed case. So when you look at the CARPHA guidelines, CARPHA points you to World Health Organization and says, look at World Health Organization's guidelines, and that is what we are using, as in CARPHA, to determine who gets tested and who doesn't get tested. And it says there are 3 options for a suspect case, and I'm going to read exactly what's there. The first option, A patient with acute respiratory illness, meaning they have fever or at least one sign or symptom of respiratory disease, cough, shortness of breath, and so forth, and a history of travel to or residence in a location reporting community transmission of COVID-19 disease during the 14 days prior to symptom onset. What does that mean? The first criteria, they have to have respiratory illness, meaning shortness of breath, coughing, or any of those. When we say flu-like symptoms, that's what we're talking about. So they have to have flu-like symptoms, and they had to have just traveled from a country that has a community spread of COVID-19. So that is one definition. The other definition that they are using is a patient with any acute respiratory illness and having been in contact with a confirmed or probable COVID-19 case, and again within the last 14 days. So if you are somebody who is having respiratory illness, meaning you are having cough and flu symptoms, and we know that you have been in contact with somebody who we know has COVID-19 or is a probable COVID-19 case, meaning everything else lines up for them, but they're lab results haven't come back yet or anything like that, but it's most likely they have COVID-19, then you would be tested. That's the second grouping. The third grouping is a patient with severe acute respiratory illness, which includes fever and at least one of the other signs, meaning cough, shortness of breath, and so forth, and they require hospitalization. And in the absence of an alternative diagnosis that fully explains the clinical presentation. What does that mean? Somebody who is having they can't breathe, they are having issues with respiratory illness, so they have maybe pneumonia is what you may classify it, meaning their lungs are inflamed, they can't breathe, they need to be hospitalized. And because we have tested them for everything else and they seem to not have everything else, we test them for COVID-19. Those are the three categories of people who CARFA is saying, because CARFA is using WHO rules, those are the WHO rules. Okay, so I just wanted us to be clear on that. This is important for us here in Tobago because we have a situation here in Tobago that is a little different to the situation that's happening in Trinidad. When I listen to the press conferences in Trinidad and so forth, I hear them specifically identifying the fact that they know the 40-something that came off of the ship, or most of the others they are saying are imported case because they either flew in, they're part of the 20,000 who flew in, blah, 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 blah. Okay. Now you would also recognize that last week, I think it was, the Minister of Health was very proud when he announced that they've been doing GIS mapping, where they can identify the locations for each of these cases that they have. And that was presented. There was a GIS map for Trinidad that has dots all over telling you where those people live and so forth. And there was a GIS map of cases for Tobago. It just had 2 dots on it because there were only 2 confirmed cases in Tobago and so forth. For Trinidad, and I want you to think about this critically, for Trinidad, there was also a second map that was presented. That second map was known as a contact tracing map, meaning for each case of COVID-19, they were able to say this person was in contact with person A, person B, person C. Those people live in Arima, down south, whatnot. If you go back to the Ministry of Health's website or their Facebook page, you would see that map has the dots, but the dots also has lines from that dot going to other places. You would notice that. You would also notice that there isn't a contact tracing map for Tobago. There wasn't a contact tracing map for Tobago. And you would think that given that Tobago only had 2 confirmed cases and Trinidad had, by that point, it would have been, 90 something or whatever, that it would have been easy, relatively easy, to do the contact tracing map for Tobago with our 2 cases. So you now have to think, why is it that they could not do that contact tracing map for Tobago with our 2 cases? Now, granted, that was before we had the 3rd confirmed case, and this was before we had the death this weekend. Okay, so there were only 2 dots. It was kind of in the middle of the week before we had the 3rd confirmed case and before we had the death over the weekend. Okay, so that is critical to understand. Because I have, people reach out to me all the time, and people have been sending information to me. A lot of it I do not speak publicly about because a lot of it is sent in confidence. There has been quite a bit of uproar, particularly over the weekend, when the gentleman died. And it's really a sad situation that this gentleman died. He died on Saturday, or was it Sunday? Over the weekend is when he died. And I think his death is what has caused many Tobagonians to now really think about how serious this situation is, and how much we need to be aware and concerned and follow the guidelines. Now let me highlight two critical things that we know. The second case that came from Tobago, they identified the fact that this person was a health care worker, was somebody working in the Scarborough General Hospital. So they identified that fact. They also, in the press briefing where they spoke about that case, they also spoke about the fact that the protocols that they had followed after identifying that case did not meet international standards. Now, they didn't say it didn't meet international standards, but when you listen to what they said they did, you would recognize that what they did not meet international standards. Because they spoke about the fact that the person, I assume it's a gentleman, I'm not sure, that the person was in the health facility, in the hospital, for several hours, and that person had continued working for some time, and the other members of staff who were working with that person, who is now a confirmed case, they continued to work. I understand that since then, I guess the Ministry of Health or whoever it was heard what they said, recognized that that was not standard international protocol, and has since said that all of the primary contacts of that person, that health professional who was the second case in Tobago, all of the people who were primary contacts, which would have included people who the person worked with, possibly patients who the person may have interacted with, and so forth, those people were then placed on quarantine. Now, we don't know whether it was self-quarantine or state-sponsored quarantine, but either way, they have since been placed on quarantine, which is good. But it opens a question that because there were breaches of the protocol initially, that we had significant exposure to other people who we now have to worry about. So that was the second case. The third confirmed case, which, as I said before, unfortunately, it's the gentleman who died over the last weekend. We were also told, by the way, kind of because members of the media were pushing and questioning and prodding, that this person was actually on the male medical ward in Tobago for quite some time, possibly, and this is me inferring, because they were diagnosed with something else. I am not sure, but they were placed on the male medical ward, and it was only after they'd been placed on the male medical ward, and I think the figure that they gave was 12 hours after being on the ward, they identified the fact that this person had COVID-19. Now again, let's think about this for a little bit. If this person was on the ward, it means that everyone who was on the ward, the other patients were possibly in contact, certainly all of the health professionals who have been in contact with that patient, the doctors, the nurses, even people who do not do health care, but the cleaners, the person who may have brought the food, maybe the person even had visitors coming to see them on the ward. So we now recognize that there are again a relatively decent volume of people who could have come into contact with this third case. And my understanding, when you ask probing questions about that case and about whether they were an imported case, it seems like that person did not have a travel history. and that person did not, at least initially, did not have any contact with anybody else who is a confirmed case, meaning any of the first person or second person. So we now have to question that situation. And if you look at the definitions that I gave earlier, if we now have a situation where we have an individual who contracted COVID-19, the person did not have a travel history, and the person seemed to not have come into contact with a confirmed or probable case of COVID-19, then now technically in Tobago we have community spread. That is what that means, because we don't know who that person may have gotten it from. We don't know who that person may have come into contact with before coming into the hospital. We don't know. The individuals who may have come into contact with that person in the hospital may also then have gone home, come into contact with their family members, did not obey the stay home orders or so. Instead of staying at home, they went and lime on the block, they smoke a blunt with somebody. We don't know. And because of all of these, particularly as it relates to those two cases, our official case 2 and case 3 in Tobago, we have to be extremely, extremely, extremely concerned that we have community spread in Tobago. Now, when I gave the definitions before, and when I highlighted the fact that the CAFA, who is the only testing agency right now in Trinidad and Tobago, and they test in Trinidad, that was to clue you in to something that I have been calling for from the beginning, which was to have testing done in Tobago also. Because let me also let you know that CAFA was very, very clear when they did their press conference last week, where they said they don't do any priority testing, meaning they test who come to them in a line. So if we have a sample coming from Tobago, it goes to CAFA and it falls in the line behind all of the samples that they had to test from Southwest, from Central, from everywhere else. It falls in the line, so our sample would get tested when our turn comes around. Our sample would get tested when our turn comes around, which may mean that we take 24 hours, maybe 48 hours to get our results back. That is something that is absolutely important for us to understand. And given the situation that's happening here in Tobago now, we have to ask ourselves whether that is the best option right now. Particularly since, again, it was last week or maybe the week before, the Minister for Health was very clear that they were going to expand testing sites in Trinidad. He spoke about the fact that they were getting new machines coming into the country from wherever they were coming from, that in addition to the CAFA site, they were going to expand the testing to the Eric Williams Medical Complex, and they were going to expand testing to the Trinidad Public Health Lab. Now, when he said that, I thought, okay, we need in Tobago to shoot up our hands quickly and say, hey, hi, hello, how you going? What about us here in Tobago, considering that getting a sample from Tobago to Trinidad is not just a drive. You have to hop on a plane or hop on a boat to get the sample to Trinidad, which means that it takes much longer to get to Trinidad, which means that it is then queued even lower in the queue when it gets to Trinidad. And because the minister was saying that they are ramping up testing in Trinidad in other sites, I thought this was a perfect opportunity for Tobago to jump up and say, let's have a site in Tobago too. Now that question was posed, that question came up, and last week the question was asked to the CMO, or to the Minister of Health, and their response was, yes, it has come up. We are willing to help Tobago get their testing site up. It means if they can't find a machine, because he said he had chatted with the CMOH and the CMOH was going to look for a PCR machine, and I'll talk a little bit about what that means in a little bit. That the CMOH was going to look for a PCR machine, but he even went further to say that even if we can't find a machine in Tobago, they are willing to loan us one, and they are willing to do the training, and they are willing to do everything that they had to do to bring Tobago up to speed so that we can test in Tobago. I finally went to bed after this whole hoopla started, feeling a little sense of relief, because finally something that we've advocated for in Tobago is going to happen. Only to hear maybe the following evening that our Tobago people are saying, no, we're not ready, we don't have the infrastructure, so we can't do testing in Tobago. And that was the most disappointing, the absolutely most disappointing news briefing that I have heard, and it sunk my spirit. Because, let me tell you why. We are in a situation in Tobago where we need to get our testing done rapidly. We need to test rapidly. This was also an opportunity for us in Tobago to upgrade our system. And this shows that we need people who could think outside the box and who can brainstorm. Because in a crisis, which is where we are, the normal processes and procedures that we normally use, they are thrown out the window because we don't have time to get, for example, 3 quotations and all of that hoopla. So the normal processes that we go through on a normal day do not apply when we are dealing with a crisis. We had an opportunity to have, if we couldn't figure it out within our own health system, and to me that is very disturbing if we cannot figure out how to get a PCR machine, which is not by no means is this the most difficult kind of testing. Now you have to be careful, you have to be technical, you have to know what you're doing to do it. But if we within the TRHA can't figure out how to get a PCR testing machine and get that up and running in Tobago, then we have serious problems. We have serious problems. And even if we can't do it in the health service, we have several private labs on the island. This could have been an opportunity to partner with a private lab, have them quickly do what they need to do to bring themselves up to speed, and have them do it for us on the island in Tobago. But it seems like that was not even thought about. So we quickly said, no thank you. And we now have a situation where we have case 2 and case 3, where we can't figure out who, what, where, when, and why these cases got COVID-19. We're not sure how many people they interacted with and all of that. Because of that, we are now in a position where we are not doing all that we can to ramp up testing in Tobago. I've made sure that I listened to the live today that the Prime Minister did and the Minister of Health and all of them did today, because I wanted to make sure before I came on here talking that they did not then come and announce, yes, we're gearing up, we're adding the 2 in Trinidad plus 1 in Tobago because this is what we need. I listened. As a matter of fact, when there was question about ramping up of testing, it included Trinidad, and there was absolutely no mention of Tobago, which makes me really think that Tobago has just lost out of the most amazing opportunity that we could have taken to ramp up testing here, to increase our capacity here. Because remember, we have to be conscious of the fact that if things go south real quickly in Trinidad, if it gets out of control really quickly in Trinidad, then we will be much later down in the list of tests that need to happen in Trinidad. It means that if those people who get tested positive in Trinidad becomes such a large number relatively quickly, it means that we don't have a situation for treating with patients in Tobago, and that's a whole different discussion. As a matter of fact, I think I will do a live separately just talking about treatment of COVID-19 and what that should mean in Tobago versus what is happening. But I don't want this one to be too long. I don't want this live to be too long. So we had a situation where we could have gotten the testing done. We could have gotten the system, even if it was not in our public health system, but we could have partnered with the private labs to get testing done in Tobago to ensure that all of those people who may have come into contact with case 1, case 2, or even case 3 can get tested very quickly, because that is what we need to do. And let me also say that if you recognize what is happening out there in the world, we heard today, for example, that Rihanna had purchased some ventilators for Barbados, and they were about to be shipped, and because the United States has an order where they are basically not allowing any medical equipment or anything like that to come out of the United States, that shipment was halted, and Barbados is not able to get that shipment. We are going to continue, because COVID-19, if you recognize, the cases are mushrooming, they are ballooning and so forth. We are going to get to the point where resources, and it's already there for many countries, PPEs, all of these things are going to be in short order. We are going to be in short order. And it means that if we do not get them now, we may not be able to get them shortly after now. Which is another reason that Tobago needed to insist on getting it now, because if we don't get it now, we may not be able to get it shortly after now. And we cannot afford that with what seems like community spread on this island. We have to show that we could do it. And you know, I'm seeing somebody mentioning that we always talk about autonomy and self-sufficiency and all of that in Tobago. This was a perfect opportunity for our leaders here in Tobago to show Trinidad that we're big, we're grown, and we know how to do it. So even though in the back of our heads, we were thinking, oh my God, I wonder we are getting lab staff. I wonder we are putting the machine. I wonder. We would have been able to say, okay, let us sit down, let us brainstorm, let us find a solution, because that is what adults do. They find the solutions to problems. And Tobago had an opportunity to find a solution to our testing problem, since we were being given the kits, given the machines, given everything that we need, and we did not take hold of that opportunity. We let that opportunity slip through our hands. I am hoping that this is not the end of it, and that the leaders who are there continue advocating, particularly since they recognize, I hope they recognize, that what is happening in Tobago is community spread, and we need to be very, very conscious, and we need to expand our rules for testing. And that's the other thing. Other places in the world, even though we have rules from WHO, rules from CARFA, and so forth, there are other countries in the world who said, okay, we know what rules you all have, but you see that rule, that ain't working for me. We going ahead and test who we need to test, because we know that we have more cases than that, and we need to do more testing. And that is also important, because a lot of research from those countries who went ahead and behaved like man and woman and said, even though WHO is making these suggestions, we are going to test more than what the WHO is limiting us. Those are the countries that have pretty decent control of the COVID-19 in their countries. Iceland, for example, Germany, for example, Singapore, for example. And a lot of these countries have been doing what is known as surveillance testing, meaning, yes, they test the people who fit the criteria that I spoke about earlier in terms of have travel history, have signs and symptoms, have been in contact with other people. But in addition to those people, they have actually just gone out and started testing random people on the street. Whether they have signs and symptoms or not, they have been testing them. And what those countries recognized is that there are significant portions of people, I think the figure that came out of Iceland is that up to 50% of the people who they tested did not have any symptoms. So they were walking around feeling perfectly well. And we do know that because of how the virus is transmitted, even if people are not coughing or sneezing, which is the main way it gets transmitted, people who have the virus who are not coughing and sneezing are also talking to people. And when you talk, the water that comes out of your mouth, the boulders, if you are using local Trinidad and Tobago term, that comes out of your mouth, the virus could be in that too, and then that goes into the air. And if you are having a conversation with somebody and you're so close to them that you could smell what they ate for breakfast or lunch, or you can tell that they are a smoker because you're smelling their breath, it means the same way the information is moving from their mouth to your nose, the same way the virus could be moving from their mouth into your nose, into your mouth. So even though they don't have signs and symptoms, they are asymptomatic and they can spread the virus. And because of that, it means that Tobago needs to expand our testing criteria and not just limit it to people who have signs and symptoms. Because if we only limit it to people who have signs and symptoms, it means we are not catching everybody. They have discovered that in other parts of the world, and we as an island who has significant autonomy to do what we need to do, that is a decision that we should have made very early up. And we could have made that decision if we had testing on our island, because when we send our samples from Tobago to Trinidad, CARFA then decides whether, based on all of the information given, whether that sample would be tested or not. And that's another thing we have to look at. I have recognized that when the Tobago House of Assembly sends out its notices about number of cases, number of samples tested, you have to go and look at it carefully. What they highlight is the number of samples submitted. That does not mean that the number of samples submitted is the number of samples tested. And that is something that we need to identify quickly, because we could be sending down 100 samples and only 50 meet the criteria and actually get tested. So when we think we are sending down and we only have 2 or 3 cases, we don't know how many of our samples are actually getting tested. We don't know. And that is something that we need to know. But if we were running our own testing here in Tobago, we could make that decision here in Tobago for ourselves. And we would not have to let CARFA or let the Ministry of Health make that decision for us. So that is critical. The other thing that we have to be conscious of the fact, and again it goes back to Tobago and the Tobago House of Assembly standing up and being man or being woman, being an adult, is that the WHO and therefore CARFA is only doing one kind of testing right now. They're only doing one kind of testing right now. And what they're doing, and I want to use the right term, is the RRT-PCR tests, which in essence, those letters mean real-time reverse transcriptase polymerase chain reaction. That's what that long thing means. In essence, that machine looks for genetic material in the virus. So if the virus is in the sample, it looks for the genetic material in the virus to say, okay, yes, it's a virus, but it is this specific virus. And that is what CARFA does too. That is the test that CARFA does. One, they first test to see if there is a virus, and the answer is yes, there's a virus. They then test to see if the virus is the SARS-CoV-2, the severe acute respiratory syndrome coronavirus-2, because that is a specific virus that causes COVID-19. Okay, so it's a 2-step process. That process is pretty expensive, and it is pretty it's the reagents and the kits and all of that stuff is pretty expensive, and it is very technical. People in a lab can do it, because that is what our lab techs have been doing. Tech 1, even Tech 2 have been doing. So that is not something that any random person could just do. But Tobago needs to also recognize that all over the world, and even if we're not talking about all over the world, we're just using the United States, because we tend to use the United States as our guide. Last week, I think the first official notice was March 20th, so it was even further than that last week. The Food and Drug Administration in the United States gave provisional and emergency approval of what are known as rapid tests for COVID-19. Those rapid tests don't test for the DNA of the virus, they actually test for the antibodies that our body creates when we have the virus inside of us. It's exactly like what we do for HIV. You can go into a clinic, in Tobago Health Promotion Clinic or any of those other places. You get a finger stick test. That test is a rapid test. You get the result in 15, 20 minutes. That test looks for the antibodies, which is our body's response. So when we have, if we have a virus inside of us, our immune system then starts acting. And one of the things the immune system does is creates antibodies for that virus. So these rapid testing machines that have gotten approval in the United States test for the antibodies for SARS-CoV-2. These tests, like the rapid HIV test, you're getting results in under an hour. There are some companies now that are telling you within 15 minutes you're getting a test. It's a little machine that, you do point of care testing. So if you're in the health center, you just take the little stick of blood, put it in the machine. Of course, you have to be careful. You have to follow all of the controls, and you get a result. And the same way we do for HIV, where after you've gotten tested using the rapid test, they then take the blood and then send it to a lab to be confirmed. We can also do that, where you do the rapid test. And if it comes back as positive, we can then take the samples again and confirm using the PCR test. That way, we can identify people quickly, because that is the critical part. We can identify people who come to us very quickly to determine whether they have it or not. And because it is a rapid test, the cost of doing the test is much smaller. It means we can also do repeated tests, because it is a fact. The same way, if you do an HIV test too soon after you've contracted HIV, you won't get a result, a positive result that is correct. The same thing applies in this one. So it's not a one-off thing, but it gives us an opportunity for people who are coming in very quickly to tell whether they are in the category of COVID-19 or not COVID-19, again, based on the other things that are going on. Based on the other criteria, we know then quickly what to do. This is something that the Tobago House of Assembly, this is something that the TRHA can jump on very quickly and do in Tobago, since we said no to the PCR testing that was offered from Trinidad. And these are the little things that makes a big difference in how we respond to this disease. The Prime Minister today said that he has been talking to leaders in other countries, in other places, and asking them, how much time did it take between when you realize you had control and then, oops, you realize you no longer have control? And the answer, he said, that he got from many of those other countries was 2 to 3 days. So today we may feel like we have control, but by Wednesday, oops, so-and-so has hit the fan. And I am afraid that even though they have control in Trinidad, we do not have that level of control in Tobago. And we are already in the point, or we are already getting to the point where the 2 or 3 day is soon coming to an end. And that is why we need to pay very special attention. That is why we need to ensure that we follow the rules. Because this is a situation, over the weekend, since the person died at the hospital, I have had so many people reach out to me absolutely panicking. And you know why they're panicking? Because they did not follow the stay-at-home order. And they went out, they went and eat, they went and lime, they went and hang out, they went and do this, they went and do that. And because Tobago is a small population and because news travels fast, when the person died, because in many instances we did not know who was case 3 until the person died. So people are now recognizing that the person who died is the person that they may have come into contact with 2 days before they went into the hospital. Different little things. They may have come into contact with either the person directly or come into contact with somebody else who came into contact with the person. And they are now messaging me, or they are now calling me scared less, because they now recognize how close they have come to being infected. Are they infected? I don't know. Only time will tell. But that is the reality of this disease. It moves, and it moves with people, and it moves with people who are not showing signs and symptoms. It moves with people who are not showing signs and symptoms. So you need to ensure that you stay home, because the one time you decide to go to the grocery because you just felt like eating ice cream, and you may have come in contact with a person who was in contact with the family, or case 2 or case 3. You may then, because you just want ice cream, and you now have to worry about having COVID-19, and more importantly, because if you're young, you're probably thinking you're good, nothing is fine, but you now have to worry because you have to go home and live with your mother or live with your granny and put them at risk. That is the issue. We cannot sit back, and we cannot be relaxed. We have to follow these rules very, very, very carefully, because we don't know. The infective rate for COVID-19 is every one person who has been infected, it's possible that they have infected at least 2 to 3 other people. And that can happen quickly. So we start with 1, it now becomes 2. Those 2 people now infect 2 to 3 other people. Those people now infect 2 to 3 other people. And before we know it, by next weekend, Tobago has moved from 2 or 3 cases to 100. Just like that. Because we did not stay home, and we did not take the heed, or we did not take the guidelines seriously. Whole of last week, we've been seeing instances where people were in front of banks, bunched up together, not social distancing in front of banks, or in front of groceries, not social distancing. What if now you would recognize that one of the people who was standing in the grouping next to you is the granny of the person who has it? That is the kind of situation we are now dealing with. And that is why it is so absolutely critical for you to stay at home. If you are not an essential worker that has to go out, stay at home. Even if you are an essential worker, but you can do what you do from home, do it from home. Because we don't have the luxury. And again, I said I would speak about treatment another time, and I'll do a live about treatment. But we are recognizing very quickly, and if you look at the rates, the people who we've treated in Tobago, because we have kept 1 person in Tobago and we sent 2 others to Trinidad, and the 1 person who we kept in Tobago died, which is a horrible track record. No, it's not statistically significant. No, we're not supposed to make any real judgment or anything like that. But the reality is, our healthcare system needs a lot of care, needs a lot of enhancing. And it means that if we now have a situation where 100 people in Tobago are now confirmed, it means that how are we sending all of them people there to Trinidad? How are we treating all of those people in Tobago? How? And we can, if we don't do this correctly, it can get out of hand, because we don't know. Okay, now there was one other thing I wanted to speak about because it was a question that was directed to me earlier, and it had to do with the fact that the person who died over the weekend was buried the same day. And that actually is the protocol that we are using. It is a WHO protocol. It's a CDC protocol where the advice is, if someone dies from COVID-19 related illness, we do the burial or the cremation ASAP. There are guidelines for how you are to interact with the body of the person. So if it is in the morgue or in the funeral home, there are guidelines for what you should be doing. The reality is, if you're in a morgue and if you're in a funeral home, you should be following those guidelines for anybody who comes in, because you don't know what that person may have. But it's even stricter, it's even more rigid for patients with COVID-19. I understand that the patient was buried here because we do not have a crematorium in Tobago. We don't do cremations in Tobago. And from all of my readings, that is fine, as long as several things happen, as long as the handling of the body was done with care, meaning everybody who had to interact with the body need to be full PPE, gloves, masks, goggles. They needed to ensure that they did not manipulate the body too much, so they didn't do anything that can cause air to come from the lungs, residual air to come from the lungs of the body back out. They shouldn't do anything that would cause parts of the body to fly into the air. So let's just say you're using a saw and power saw and that kind of thing. They shouldn't be doing any of that. They shouldn't be doing any of that with the body. Embalming is also not recommended because the data basically says we don't know if you are putting the staff at increased risk by doing the embalming process, so they are not embalming. The body needs to be kept in at least 2 bags, so it needs to be double bagged, and everyone needs to know that they are carrying a patient, a body that died from COVID-19. And the rules are very, very clear. I know one of the questions that came up had to do with the fact that we buried the body and whether that was safe. And from all of my reading, that is safe as long as we don't go and dig up the body too soon. And I think that was the concern, because we have had situations in Tobago, because our cemeteries, particularly our public cemeteries, seem to be overrun. I have been to many funerals where I swear the funeral I went to last week was in that same spot or very close to that spot. So we are now digging up spots. We are hoping that the time between when we quote unquote reuse a spot, and I'm not even sure if that's what we do, or when we get close to a spot, that the time between then and now is so long, is so far apart that it is not a risk to anyone. It's not a risk to anyone. And again, because the virus cannot live on its own for very, 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 very long, although we don't know exactly how long it can live. I am guessing that even if somebody accidentally digs up that spot, let's say 10 years from now, that shouldn't be an issue. But then again, we don't know. There are so many things about this virus that we don't know that it's hard to make any definitive answer to say yes or no. Okay, so I just wanted to touch on that. Just to allay fears that yes, they had a funeral service where they allowed a small number of family members, because now, remember, gatherings are not supposed to be more than 5 people. So that also applies to funerals. So there was a funeral, there was a very small gathering, and if they follow all of the guidelines, we hope that everything would be fine, even if we did not have, even if it did not have a cremation done. Somebody saying that the spot should be marked. Maybe, possibly. Maybe there should be a special kind of marking so that people know, or so that the funeral staff know, and the cemetery staff know, but not necessarily for anybody to pass to have big COVID written on it. I don't know that that's a good idea, but I don't know. We have to see. We would see. And we would then have to figure out what is the best thing and what is the safer thing as we learn more about this. All right? Before I go, I wanted to quickly just talk about the face mask thing, because our Minister of Health, our Prime Minister, our CMO, and everybody basically has agreed that we are to use face masks if we have to go out in public. And I say if because, yes, the medical professionals who have to go out, they are going to continue using the surgical mask and the N95 respirator, depending on what they are doing, depending on the procedure that they are doing. But what is recommended is that the average man on the ground, if you must leave your house, if you must go out, like as I said this morning on Channel 5, if you on your last can of sardine and you absolutely need to go to the grocery, then you also need to wear a mask, a cloth mask, in those high traffic areas. Because when you go to those areas, even though they limit the number of people who can be in the groceries, for example, you may still have to pass somebody, along the aisle, pass somebody real quickly. So it's still a possibility of come into contact with somebody who may have it. The other thing about wearing the mask, which is more important, is we now have to behave as if we have it. Again, because there are so many people who we've discovered are asymptomatic, meaning they don't have symptoms, they're not coughing or they're not sneezing. Those people have it, and those people can pass it on. When you go to the grocery or when you go to the drugstore, whatever, you need to wear your mask and talk through it, because we don't want a situation where you are asymptomatic, you don't feel sick, you don't have symptoms, but you have the virus inside of you, and because you are speaking, you then spread the virus to somebody else in that area. And that really is the reason why we are now saying wear the mask out there. But to be clear, you're wearing cloth masks, and you are not going to buy up all of the surgical masks and N95 masks, because those are the masks we need for our health professionals to ensure that they are safe. For those who are making masks on their own, because we have a lot of we have people who are seamstresses and so forth, you have to be very careful with the kind of material that you're using for the mask. So you don't go thinking, well, this is a fashion show. Okay, so you finding the cutest material you have home, which might happen to be a lace something, because you're going out and you need the world to see your mask looking good. No. You need to look for material that you cannot, because remember, the point is, if you are talking, you want to trap your boulders. If you accidentally sneeze or cough, and if we really think about it, if we are getting sick, the first time we sneeze or cough, it usually catches us by surprise, because we're not sick, we're not feeling anything, and you may not have even had time to put up your hand, which we're saying don't even put up your hand, to put up your elbow. So you didn't even have time to think about that, and the cough and the sneeze is out. So just in case something like that happens, you have the cloth over your mouth to capture that. Now, if you are using a cloth that has a lot of holes, then you're not capturing anything. You're not capturing a thing. And that is why you are wearing the mask, to capture it. So you need to look at the different kinds of fabrics you have at home. There are several things that you can do. Of course, these are not scientific, but it would help you weed out what fabrics you have. Put the fabric up to light. If you see right through the fabric, it means it has plenty hole, that light passing through, and that's not a good kind of fabric to use. That's as simple as that. If you put it up to the fan, simple fan, and you could put your hand, this is the fabric and the hand's there, and you're feeling the fan breeze, that is not a decent fabric for you to use, because it means the breeze is still going through it. There is something known as the aerosol test, which again is not scientific by any means, but you have an aerosol, any kind of aerosol, deodorant spray, fly spray, any kind of aerosol that you spray, and if you put it up to the fabric and spray, and if you see the aerosol particles coming out, then you know that fabric is not the best. You then have to look at it and say, okay, if that is the only fabric you have, you may then to double, triple, quadruple it. And I'm seeing studies now that speak about the fact that even though fabrics are not great, doubling it gives you some protection, but doing 4 layers gives you even more protection. So these are little things you need to do. Don't just run out and grab a piece of fabric and start sewing. Do the test. Use the different fabrics you have at home. See which one is knit. See which one is tight. See which one does not allow air, does not allow light or air, any of those things to come through. And those are the kinds of fabrics that you need to use. The other thing is, if you and when you make these masks, or even if you buy them, because there are people selling them, you need to practice wearing them at home. Because we are not used to masks covering our faces. We are not used to talking with masks. The first time you put it on, it is going to be as uncomfortable as hell. It is going to be. You're going to feel like it's suffocating. You're going to feel like you can't talk, because it is something new, something that we're not used to, and you need to get used to it. So you need to put it on at home, walk around with it, get used to talking with it, get used to interacting with it. Because the other thing that happens, and this is one of the reasons that they were dissuading people from wearing masks, is the first time you put it on, because you're so not used to it, you touch it all the time, because you're trying to shift it, you're trying to move it, you're trying to make it fit properly. And because you're touching it so often, you are more likely to touch your face. And you don't want to be in a position where you are now figuring out what to do, now realizing that it is not the most comfortable thing outside after you just touch the door or you just touch the handle of the grocery. So stay home, do the mask home, put it on at home, get used to it at home, so that if you have to go out, you are accustomed to wearing it when you go out. Don't do like some people. I have actually seen things where they have on the mask, and because the mask feels constrictive, if they have to sneeze, they take off the mask and sneeze. Oh God, what is the point of putting on the mask if that's what you're going to do? So you have to get used to doing it and used to doing that kind of stuff with it. Okay? So those were some of the main issues. Let me just quickly go through the comments just to make sure I haven't missed anything. If you have any questions, let me know. Quickly, I would try to answer. And certainly follow the guidelines. Ensure that you stay at home. Ensure that even if you are an essential service, you do your essential work from home. We now have technology that can help us. You don't have to do any face-to-face meeting. Actually, the one good thing about COVID-19 is that we're recognizing that we don't have to sit in the same room to be in a meeting with anybody ever again. Oh my gosh. That's perfect for me. So we don't have to do that again. We could all use Zoom, or all use Google, or all use any of those things. Somebody that asked where are the testing sites for Tobago. As I said, we don't have any testing sites in Tobago. We have to send our samples to Trinidad, and that is one of the things I've been advocating for, because it needs to be happening in Tobago so that we can have rush service, so that we are not going in the line behind everybody in Trinidad, and that we can have quick turnaround here, and so that we can make our rules as to who needs to be tested here, because we may have community spread on the island of Tobago, and because of that we may need to change the rules about who gets tested. And if we are sending our samples to Trinidad, Trinidad decides whether we have to follow their rules, and then they could decide whether they accept the samples or not. Seems like he was buried in such a quick space of time. I'd like to know if the family was informed and if they agreed to such decisions, and if no, if they aren't in agreement, does the protocol overrule? So the family was informed, as far as I understand. As a matter of fact, a couple members of the family were at the funeral, but only 1 or 2 or 3, because you can't have plenty of people. But yes, they were informed. But in a situation like this, the CDC rules or the WHO rules, or the rules that says you can't have plenty of people, you need to bury them real quick, applies. So you can't have a situation where you're waiting for family to come in, or none of that. Well, the border's closed anyway, so nobody ain't coming in. But yeah, that is a situation that applies, and in a situation like this, the recommendation is to get rid of the body as quickly as possible. Within a day, get rid of the body. Yeah. Our hospital here stopped visitors only if someone is dying and one family member is allowed to visit. No viewing of the COVID patient who died in the hospital. Only significant other is the only other person allowed for baby delivery. Critical. again, the hospital and the stopping visitors, that is something that I would discuss when I do another live about what our treatment should look like in Tobago, because that is something that has to happen. It is too critical for us to just allow people to go in. I know we've limited the amount of visitors we have in Tobago, but it needs to stop completely, to be honest. And I've actually seen a case in the US, I can't remember where a male was hiding his illness while he was in the birth room while his wife or significant other was giving birth. He hid the illness. Of course, he had COVID-19, and now I hear that the wife has COVID-19. And because of that, they've now exposed everybody who was in the area close to them, everybody who was in the room, the healthcare professionals, everybody have been exposed now because of that selfish act of that person. So yeah, we can't have, we would, even a situation like that, we would have to limit and not even have visitors in any of these medical situations. Let me again quick go through. So I think I have answered. How was he exposed? Ria, I don't know. I don't know that anybody knows the answer to that, and that's part of the issue. If when this live is finished, you could go back and listen to the first part of it, because I did speak about the fact that we seem to be having a little bit of an issue with our contact tracing for any of these, which is why I am guardedly, but I am using the term community spread, because that in essence is what community spread is. We are not sure. The person definitely did not travel, as far as I understand, and so we don't know. We don't know. Yes. So okay, so I think I have answered all of the questions that are there. So again, bottom line, we need to be careful. The longer we take to follow the rules, the more we just go out and lime, the more we just leave our homes for no reason whatsoever, the longer it would take for us to halt this wave of infection that's happening. So we really, really need people to pay very, very close attention, particularly if you're in the island of Tobago, where everybody related to everybody, and we have way less than 6 degrees of separation here. So the fact that you are going down by the bay to stand up waiting for fish means that you really may have come into contact with somebody who came into contact with somebody who has the virus already. And that is putting yourself at undue, unnecessary risk. So definitely stay home, stay home, stay home, stay home, stay home, stay home. Keep washing your hands. Even home, wash your hands. Wash your hands all the time, because you need to practice washing your hands continually. If you have to go out, if God forbid you actually must leave your house, you must venture out, ensure that you wear the cloth mask. Ensure that you still stay at least 6 feet away from everybody else around you. You have to exercise all of those things. And we are recognizing that the only reason why our government is actually having more rigid restrictions is because people have not been following even the loose ones. So we have to hammer down on people. We have to treat adults like children, unfortunately, which is a sad situation for us to be in here in Tobago. So I think that's it. Thank you all for tuning in. Thank you all for following. Thank you for sharing the live. If you have any more questions, please feel free to message me privately. I would answer any questions. If I can, I would answer. If I can't, well, I'll let you know that I can't answer the question. And I would keep doing these as things come up. As I said before, I will specifically do a live about treatment in Tobago and what that needs to look like. That would probably be later in the week, and so that we have a better sense of what needs to happen to ensure that we are well prepared. All right, so thank you all so much for tuning in. Have a great day. Stay safe, stay home, stay safe, stay home. Essential workers, you do what you need to do to stay alive. Do what you need to do to stay alive. So guys, thank you all so much. Bye.